The human body was designed to move, and for thousands of years that's what we did. However, rapid advances in technology have created a huge problem, especially in America: obesity. Between 1960 and 2009, the prevalence of obese adults in the United States increased from 13 to 34%, while the prevalence of morbidly obese individuals increased from 0.9 to 6%. Weight that is higher than what is considered healthy for a given height is generally defined as overweight or obese. The most common screening tool for assessing obesity is known as body mass index, or BMI. Two factors at the forefront of the obesity epidemic are increased calorie intake and physical inactivity. As a standard, the average American woman needs between 1,800 and 2,400 calories per day, while the average American man needs between 2,400 and 3,000 calories per day, according to the Department of Agriculture's 2010 guidelines. The amount of calories you actually need varies on an individual basis, considering daily physical activity level. The CDC estimates that 80% of Americans do not get the recommended amount of exercise each week, which potentially sets them up for health problems. Community environments need to encourage good exercise behaviors. For example, lack of sidewalks and parks negatively influence people to drive and watch TV instead of walking and getting out of the house. Some illnesses may lead to weight gain, including Cushing's disease and polycystic ovary syndrome, as well as some drugs, including steroids and antidepressants. Osteoarthritis, also known as degenerative joint disease, is the most common joint disease associated with obesity. In the United States, more than 27 million adults have been diagnosed with OA. Osteoarthritis can occur in any of the three types of joints, but is mostly found in weight-bearing joints. Therefore, the more you weigh, the more force is being applied to the joint, and the more likely you are to develop OA. Rheumatoid arthritis, another condition that can be associated with obesity, is a systemic autoimmune disease that causes inflammation and can damage many of the systems of the body. Adipose tissue cells make inflammatory chemicals that can irritate tissues of the joints. It is estimated that an obese patient is 60% more likely to develop arthritis compared to someone with a BMI in the healthy range. There are an array of increased risks to the cardiovascular system associated with obesity, including heart attack, elevated cholesterol causing atherosclerosis, abnormal heart rhythms, hypertension, peripheral vascular disease, and stroke. The endocrine system may also have negative impacts on the cardiovascular system, as seen in type 2 diabetes. Though diabetes is treatable, it has several correlations to cardiovascular disease. Studies report an association between hypertension and insulin resistance, nearly doubling the risk for CVD. It is estimated that 90% of people diagnosed with type 2 diabetes are either overweight or obese. Several respiratory issues can be related to obesity according to the CDC. However, the likelihood of having sleep apnea syndrome is greatly increased. Sleep apnea is a condition in which breathing is stopped for a period of time long enough for blood oxygen levels to drop. It is estimated that 40 to 90% of moderately overweight or obese individuals have obstructive sleep apnea. Asthma is a condition caused by various conditions resulting in constriction of the bronchial airways, dyspnea, coughing, and wheezing. It can cause violent spasms of the bronchi, but is generally not life-threatening. A study conducted from 2011 to 2014 showed current asthma prevalence was 8.8% among all adults. During this time, asthma was more prevalent in obese individuals, 11.1%, compared to adults in the normal weight category, 7.1%. Treatment options for obesity include dietary modification, behavior modification, exercise, medication, and surgery. Two categories of diets include low-calorie diets and very low-calorie diets. LCDs are designed to include 500 to 1,000 calories per day less than an individual burns. VLCDs limit caloric intake to 400 to 800 calories per day and feature high-protein, low-fat liquids. Some of the steps that may help an individual including recording your diet and exercise, identifying high-risk situations and avoiding them, developing a support network, and setting realistic weight goals. The CDC recommends at least 225 minutes of moderate to vigorous exercise per week for cardiovascular health. When diet and exercise alone are not an option or fail to accomplish weight loss goals, medication and surgery may be considered. Studies have shown that patients on these types of medications lose around 10% of their excess weight. It should be noted, however, there are several negative side effects associated with these medication treatments. Most patients also experience weight gain upon stopping use of these medications. As a last resort, some doctors may advise weight loss surgery for patients in excess of 100 pounds over ideal weight or a BMI of 40 plus. Bariatric surgery involves sealing off most of the stomach to reduce the quantity of food an individual can consume, but this surgery has several risks leading up to death involved. In conclusion, obesity is an epidemic that must be taken seriously among individuals, especially in the United States. Calculating BMI takes all of 5 minutes with a quick Google search for an online BMI calculator. Talking with a doctor about strategies for addressing weight loss is always recommended to fully understand personal limitations and potential complications. There is such a vast amount of health risks associated with carrying large amounts of excess weight around. Almost every major system in the body can incur serious complications from obesity. Taking the first step to address the weight problem and creating a strategic plan may be the hardest part of the process. Having the support of doctors, coaches, friends, and family can be a great motivator in creating a new healthy lifestyle. However, it all comes down to the perseverance of the individual. Healthy weight loss by means of exercise and nutritious diet should always be attempted before taking other measures into account. Making small behavioral changes such as parking the car in the rear of the parking lot instead of the front can make a huge difference in attaining weight loss goals. If all else fails, take the time to consider the positive and negative impacts of medications and surgery, and realize that extreme weight loss is not a sprint but rather than a lifelong marathon. Anyone is capable of turning obesity around with a strong mindset and hard work ethic.